Hey there, Nikki Burnett here, Taste Life Nutrition, functional nutritionist and health detective. Yesterday, for my post for SoulFull Conception, we were talking about oil pulling for fertility and how it can impact preconception care and planning. So I thought today we would chat a little bit about amalgam fillings and how important they are, how important it is to understand the impact that they can have on your health. For one, your health as a whole, right? But for two, how can it affect the health while you're trying to get pregnant? How can it affect your fertility? And how can it affect you while being pregnant as well as after giving birth? So a couple of things to keep in mind is toxicity leads to deficiency. So if you are toxic, whether it's with amalgam fillings or other sorts of toxic burdens, plus inflammation, that can create even more toxicity. So it's important to understand your toxic burden, understand if you have amalgam fillings and if it's necessary to eliminate them. There are a couple of things to understand about mercury. It is one of the top 5 most toxic elements on Earth. Okay, and it is everywhere. So be aware of your light bulbs, be aware of what's in your mouth, be aware of your thermometers, all of these things. Even some will say in the fish we eat, some will say it's not so bad, but just something to be super aware of. Understanding that the complications from mercury can be as much as interfering with immune system function, memory retention, chronic health issues. I'm reading my notes over here. So it can affect your hypothalamus and your pituitary, your HPA axis, so it's your hypothalamic pituitary axis. Menstruation difficulties, reduced sperm count, ovulation disorders, miscarriages, and premature birth. So this is a significant problem. And for those who have specific epigenetic effects, this isn't fertility necessarily, but later in life, epigenetic variants, if you're not able to detoxify mercury, it has the potential of lots of factors that can go into this, but it has the potential of affecting the brain and creating an Alzheimer's risk. So want to make sure that you understand that it's a neurotoxin, that it is carcinogenic, that it can pass through when you're pregnant. It can pass through onto baby. It also can pass through to a lesser extent, but it can pass on through breast milk. So these are significant when it comes to all things fertility, all things preconception planning, all things planning for your future and the future health of your family. So keep that in mind. Reach out if you have any questions. I'm always here to serve. Look for SoulFull Conception. We're launching soon. This is going to be a game changer as far as preconception planning and fertility is concerned. Looking forward to connecting with you.